If you're new to my story, I'm 41 and I recently started HRT, hormone replacement therapy, and I'm about 5 weeks out from my meds, and I've been giving weekly updates. And usually I'm in a parking lot because that's when I find a time to just hit the pause button on my life and update and reflect on how I'm doing. But it's spring break, and that means my kids are home. So, like any good mom, I'm hiding in my car in the garage instead of a parking lot this week. Um, my kids are older, 10 and 13, so they're fine. But if you watched my video last week, this week's video is important because I'm sharing my pelvic ultrasound results, and I have good news and bad news. The bad news is that my Midi nurse practitioner, today, I was supposed to have my follow-up appointment, and I woke up to a text message from their system saying that my appointment had been rescheduled for 10 days from now. And so I've been really looking forward to this appointment for a couple of weeks now. And I was disappointed that that was canceled. But the good news is that I met with my primary care physician earlier this week, and she was actually able to reinforce a lot of what I've been told so far from my Midi practitioner, which made me feel so much better. And as a side note, the reason I met with my primary doctor was I also have ulcerative colitis, and I think I'll do a series on that and how I think it might have affected my my symptoms, but also like my ability to weed through what was ulcerative colitis and what was perimenopause. So put in the comments of this video if that's something that you're interested in, or maybe you have ulcerative colitis as well, and we could connect on that because I got that diagnosis about 2 years ago. So that's something else that I had to go down a rabbit hole to figure out what was going on with my body. But my GI doctor left the area, and so I'm needing to establish a new GI doctor. And the new doctor would only accept me if I got a referral. So that's why I was with my primary care doctor this week, not even really seeing her about my perimenopause symptoms, because I think I'm still getting used to the fact that I have a primary doctor. I've never really needed one. I don't know what healthcare is like in your area, but where I live, there aren't a lot of options for doctors, and people tend to see specialists for things. Like I go to the dermatologist to get my skin cancer checks each year. I go to the eye doctor. I go to the dentist. I had a GI doctor for my GI symptoms and subsequent management of ulcerative colitis. And then if I would ever get a sinus infection or something that I felt needed antibiotics, which was rare, then I would go to an urgent care where you just see the doctor on staff, they take your insurance, they write you a prescription, and that's it. So that's how I've managed my healthcare so far. But because my age is, becoming midlife, I felt the need to establish a primary doctor a couple years ago when I turned 40. And I knew I would have things coming up like mammograms. I got my first mammogram when I was 40. And people just tend to have more healthcare needs as they age, right? So anyway, I established a primary care doctor back then, haven't really needed her. Honestly, haven't even been in that office since. But when the GI referral came up, I made the appointment, and I was in her office earlier this week. And, you discuss whatever meds you're currently on. So I had to say I'm on the low-dose estrogen patch and progesterone for perimenopause symptoms. And I had brought a copy of my lab work with me my Midi lab work. So I wanted her to review it. I think because I was worried that she would not agree with my HRT meds. So I wanted her to be able to review it as well. And sorry, I know I'm jumping around in this a lot, but this is kind of what life is like, right? Especially if you're coming into your midlife years, and I'm juggling more than one set of symptoms and multiple doctors. So I don't know, sometimes it gets kind of lost in my brain. But my primary doctor is under the same umbrella company organization as where I did my imaging for my pelvic ultrasound. And she was able to see the pelvic ultrasound results. So let me tell you, my ultrasound came back great. I have no uterine fibroids, so that's a win. My uterine lining is normal. It's not thick, so we were worried about fibroids. We were worried about the thickness of my lining. Both of those are clear. They only could get a great view of my right ovary. I don't have any, it said no worrisome cysts. So that I'm like an overthinker. So that makes me wonder, does that mean I have cysts? They just weren't worrisome. Either way, I guess it's nothing to worry about. And my blood flow, because if you remember, I was on my period at the time. My blood flow was normal. So for my irregular cycles that I've been having leading up to this perimenopause diagnosis, there isn't anything else that would be making my periods irregular other than perimenopause. And it just feels good to have the peace of mind that my Midi practitioner was doing the right thing by ordering my labs, ordering the pelvic ultrasound, and I'm, looking under all the stones to make sure I'm not missing some other piece of my reproductive health. And being on my meds is the right thing for me. And that feels good. So yeah, the ultrasound came back normal. My primary doctor, when she was reviewing my lab work, she pointed out one of the levels they tested was FSH, and that stands for follicle stimulating hormone. And the way my Midi practitioner described that is the higher the number, that means your body is like trying to put the foot on the gas to stimulate ovulation and your menstrual cycle. So that makes sense that mine was high because I wasn't menstruating. And that is a sign of perimenopause when you have a high FSH level. My primary doctor said she looks for a number that is 25 or higher as a marker for perimenopause. And my level was over 50, so more than double that. And it's just another clear indicator that I do need to be on HRT. And I'm 41. I don't think a lot of 41-year-old women expect that they are already in this phase. It's caught me off guard for sure. And I started kind of doubting myself, before I had the primary care physician appointment and before I knew the results of the ultrasound. I started thinking, am I crazy? Like, am I kind of making all this up? Is this really what's happening with my body right now? But I'm not making it up, and it is what my body is going through right now. And there's nothing wrong with that. I don't know. I feel I feel good that all signs point towards perimenopause. And with my FSH level, I may actually be more like mid perimenopause, not early. And that's kind of what I had been feeling. So yeah, let me know in the comments if you have questions about how to navigate like your primary care doctor and Midi, how those things work together. I think that people are wondering, like, does one replace the other? Can you use Midi and your primary care physician? Can you just use Midi? So I don't know. I think I'm still figuring that out myself, but those are the types of questions and conversations I'd love to see in the comments. And if you want to know more about ulcerative colitis, put that in the comments too. But otherwise, I'll see you in the next parking lot.